Hi, everyone. Welcome to our webinar. Thank you for joining us this evening, or if you're watching our recording, thank you for joining us, whatever time of day it might be for you. I'm super excited to be partnering up with Rectangle Health today to talk about how to protect your practice. We're going to go through a lot of aspects of compliance, both from the HIPAA side, the HR side, because so much of that ties in together. So my name is Jill Hasselman. I am the head of strategic partnerships at HR for Health. And we have Ryan Merriman joining us today, who is the enterprise account manager at Rectangle Health. Welcome, Ryan. Thank you for joining us.
Thank you so much for having me, Jill. Much appreciated.
So today we're going to go over a little bit about just background on HR for Health and Rectangle Health, what our focus is of helping our clients, our partners, and then dive into really the meat of this, which is what is HIPAA and HR all about? What's kind of the 101 that everyone needs to know? And then both on the HIPAA and the HR side, what are the tips to bring yourself into full compliance? Because we know that there's a lot of things that you have to keep up on. So we want to make it as bite-sized as possible so you all leave feeling very confident about what you need to, enact in your practices after leaving this. And I know that Ryan has some good resources, especially with some of the breaches that have been happening, to give you resources around that so you have awareness of how this impacts your practice. So a lot of information that's going to be packed into today's session. So right at the top, our goal at HR for Health is to essentially make the complexities of HR really easy to manage. So we realize that not only is it difficult to stay up on all of the changes in the laws throughout the year, but it's also really difficult to find an individual that you can employ full time that understands these requirements and how they translate to your practice. So our focus through technology is to ensure that the entire journey with your team, from onboarding all the way to termination, policies, procedures, timekeeping, payroll, all of those things are managed seamlessly and safely through our technology and our team here to help you. And Ryan, if you could tell us a little about Rectangle Health, that'd be great.
Absolutely. So it's funny. We actually share a very common mission statement. Ours is simplifying the business side of healthcare. So historically, Rectangle Health, we have been one of the number one payment solutions in the country for the past 30 years in healthcare, and specifically, kind of focused around the PCI compliance piece for our clients. But furthermore, what we're going to be discussing today is kind of that in-clinic compliance solution. So we are a full kind of a turnkey solution when it comes to all things, all software needed for healthcare practices. And one of the biggest things about us is not only do we offer PCI and HIPAA compliant payment solutions, but today we're going to be discussing that we now offer an in-clinic turnkey dashboard for all things HIPAA and OSHA as well. Um, this slide right there, that kind of represented, we work with more than 5,000 practices, 50,000 different providers across the country. And most importantly, I think, was the societies. So there's over 200 different societies that back and promote our software solutions. So that's a great slide. I'm glad that you guys had that one.
Yeah. Yeah, and really our goal is, both at Rectangle Health and HR for Health, our goal is to use these softwares and technologies to make things as efficient and easy for the individuals within the practice, regardless of the position, but whatever focus it is through managing these pieces of compliance and PCI and HIPAA and HR, and that is as easy as possible by leveraging the technology. So we're really excited about the partnership and being able to support one another and being able to support our clients in that mutual goal that Ryan mentioned is really how do we make your lives easier, because we know that these topics are not always ones that maybe you want to pay attention to, and that's because it's kind of hard to decipher what you need to be doing within them, which brings us to our next point as we transition into HIPAA 101. And so I'm going to pass that to Ryan as the expert of really what needs to go into that and what you need to be focusing on.
Absolutely. So, the main thing is when it comes to HIPAA, right, is pretty much the words on the screen right now. There's no one size fits all. So the main thing is, when it comes to new hires or, yearly requirements, risk assessments, binders, your safety data sheets. There's all these little requirements that are mandatory. The only unfortunate thing is, as a provider, HIPAA will never proactively reach out and say we changed this policy or we added this policy. So it's really important to make sure that we're staying current, to make sure we're doing an annual risk assessment, to make sure that new hires are getting trained, and that's where having a software solution, kind of a one truth, I like to call it, whether it's you're a 1-2 doc practice, 1-2 locations, or you're a 100 location DSO. It's very important to have just a simple consolidated solution so that everybody can access that. We're going to kind of talk more in the weeds about that. I don't know if the next slide has it, but this is normally right where I kind of start a conversation with a clinic. And this is, I know it sounds kind of black and white, but that's literally how HIPAA and OSHA work. Either you have these things in place or you don't. The penalties for not having these things in place can be substantial. So we want to make sure that we're taking a preemptive strike. So basically, what we're trying to do with something like this is start off with training, right? How is training currently being done? So most people, they either have a consultant come in once a year. We shut down the practice for, 2-3 hours, and then, we do our kind of yearly annual training and that person goes away. But what happens if we get 6 new hires in July, November, and whatever, March, and we did our big training in January, Feb? That's where having a software that is constantly accessible can be very, very important. Another thing that we like to kind of point out with people that do this big annual training is that does cost time and money. But most importantly, if we shut down the practice for 3 or 4 hours, that might be $2,000 or $3,000 in revenue, right? So that's where, having a solution that can be accessible and is constantly 24/7, especially with new hires, like you were saying, it's a huge, huge thing in our world, turnover. That's kind of where I start with the training. We want to make sure we have a designated officer, right? So whether that's an office manager who's wearing that hat, usually they're wearing 9 other ones, but we want to make sure there's a designated officer, security officer versus, I think Susie does that, right? Binders. I know it sounds silly, but we want to make sure that we have a current, customized, updated binder. Um, that is one of the biggest things I see in my consultations is people say, "Oh yeah, we got one. It's somewhere here." I think the last time we updated it was maybe 2 or 3 years ago, right? And unfortunately, you know, that is one of the first things that would happen if there was an audit or a breach, is they would say, we want to see your binder, we want to make sure your policies are customized, and most importantly, updated. So emergency plan. That's the next kind of bullet point there. That's that who, what, when, where. If there's ever a natural disaster, God forbid, right? Fire, flood. And what it's doing is it's showing OSHA, it's showing HIPAA that you took the time as a practice to go, here's our plan. If this happens, you put it in your lunchroom, right? Your OSHA labor laws, usually the emergency plan, I like to recommend putting that side by side. And then the last bullet point is common sense versus actual compliance experts and lawyers, right? So that really is leading towards your business associate agreements, right? Having a consultant, taking proper training, and everything we're trying to do here is we're just trying to make sure that we're working towards a more formal and secure approach to compliance rather than a possibly casual and vulnerable. Because at the end of the day, like I said, no matter how big your organization is, it's still a very, very big investment from the doctors. And we want to make sure we take the right steps to protect that.
Mhm. Because here's what happens if you don't, right?
I was gonna say. So here's what happens if you don't. And this is the other reality that, you know, and not that most people kind of put their head in the sand and go, it'll never happen to me, right? And that's where I always kind of, put it towards you wouldn't have a house without house insurance, home insurance, right? You wouldn't drive your car without car insurance. And this is another reason why, we're going to talk a little bit later about cyber insurance and stuff like that. But HIPAA, unfortunately, they don't care if you are a single location with two employees or a 100 locations with 300 employees. It really boils down to what tier that practice fell into, if there was ever a breach or an audit, right? So when we talk about the Change Healthcare thing that just happened, that affected a lot of people, but we also want to make sure that we're just staying out of that kind of tier three, tier four, which you can see in the slide, which is willful neglect, right? Meaning we know our binder wasn't customized. We know we had a new hire handling patient information or even EPHI, electronic protected health information. And we took no steps to either fix the gap, fix the problem. And that's where, some of these penalties, ten to $50,000 per violation. I mean, that can be, that could be close up the doors time. So that's why, I respect on a business level, right? Keeping a healthy practice, right? Keeping your patients in the chair, increasing, your kind of flow of patients. That is just as important, but this stuff is also, it's just something that we cannot take a reactive approach on. And this is why. One of the other things too, I had mentioned when we talked was I always like to show my clients, there's a link that we would normally send. Morgan just put that in the chat for us. So that link is the U.S. Department of Health and Human Services breach portal. And I always show that to my clients because what that is, Jill, is it's actually a live feed of practices that have been compromised and are currently under investigation. And unfortunately, when you look at that, it's pretty shocking to see how common it is. And
Mhm.
especially in healthcare, if you kind of step back and you think about your practice management software, right? Your third party billing, your IT, cloud-based storage. When you mix in name, date of birth, right, social, where they live, credit card information, you really almost have everything you need to steal someone's identity. And that's why, unfortunately, it's a very lucrative business for hackers. And that's why that list is unfortunately so active. So
Yeah.
that's where, as a consultant, my company, with our compliance solution, we make sure that not only are we giving you a tool to kind of set you up for success, but we want to make sure people understand, when it happens, why it happens, and next steps.
Yep. Yeah. And that link was dropped into the chat. We also will send that link as a follow-up in the email for this webinar so that everybody has it so that they can check because I think it's such a good point. It's just that awareness of knowing what's going on. Is this impacting you? And, to the point made earlier, it's impacting a lot of practices without maybe them even knowing. So I think that's a great resource to be able to use and just at least get that awareness.
Yeah. And one of the main reasons why I show that, Jill, is you'll notice there's a really common thread. It's normally, not normally, but 50% of the time it's a business associate, right?
Mm,
So it's either a shredding company, it's an IT. So it's not something that's happening in clinic. And that's another thing that we train our clients on is, we have HIPAA attorneys that make sure every business associate agreement has what's called an indemnification clause, or what's
mm.
also known as the indemnity clause. And what that means is if a business associate is compromised, it would not fall back on the practice for penalties and violations. So that's
Yeah.
another, once again, I'm going to say that word a lot, but a preemptive strike to be set up for success.
Yeah. Yeah, our goal is to be proactive on all these fronts and on the HR side just as much. And I think I was actually at a conference last week where I've been with HR for Health for over 10 years. And last week, somebody said to me, yeah, HR is really becoming the forefront now. I'm like, now? What do you mean? This has always been important. But the reality is that the chance of having some sort of claim from an employee is on the rise right now. And there are a lot of reasons for this. Some of this is related to kind of this post COVID world and how things within the workplace are now functioning a little bit different than before. A lot of it can also be related to like the current administration that's in office, the government officials that are overseeing state laws, federal laws, but it really all comes back to this common theme that things are constantly changing and it's really hard to keep up with that. And the dollar amount of these consequences can be really high. We just saw that on, the breach side that also comes down to the employee side as well. And, it's not just the dollar amount that comes with these claims. Like, yeah, that can definitely impact a practice and your revenue, but it also brings a distraction to the practice. The team knows what's going on. There's a loss in productivity. And so we really want to be able to position ourselves from a proactive standpoint of how can we either make these vulnerabilities go away completely, or if we can't make them go away completely, how do we reduce that as much as possible so there isn't that outside noise. And HR compliance really isn't just a nice to have. It incorporates all the legal requirements and really the best practices that are not optional, that might be seen as optional if you haven't had a claim or you've been flying under the radar. The reality is that this applies to all different practices. And of course, we have our state specific laws, our local laws, the federal laws, and there's a lot that plays into it, but it's important to look at HR as not, strictly just recruiting or making sure the employees are happy. That's an important part, definitely, but there's other parts that have to be looked at when it comes to, the compliance side of things. And kind of similar to the HIPAA side, the courts are generally really not that forgiving when it comes to a lack of awareness of laws or compliance. So that saying of ignorance is bliss really doesn't apply to the case of HR compliance. So we're going to talk about some tips and tricks of how to look at federal, state, local laws, making sure you're staying up on those. But I think the common theme here, as was mentioned, has been mentioned throughout, is you wouldn't operate your practice without malpractice insurance, for example. So having these tools in place that are the right tools to keep your HR in order are really, really important. And when we look at kind of what goes into HR, really, I think it's important. Think of the role of HR in the practice as a way to bridge between the practice and the employees with a focus on how do we ensure smooth functioning for the employment journey and also effective communication throughout. So the efforts around your HR should really focus on fostering employee engagement. And that doesn't necessarily mean like you give the employees everything they could possibly want and the practice comes last. There is absolutely a real play of, okay, how are the employees contributing and making sure that they that is relating to engagement. It's not just on the practice to give. That's a two-way street, but looking at your HR as a way to foster that and also resolving conflicts. For whatever reason, we have seen at HR for Health recently a pretty large uptick in interpersonal conflict. And so the role of HR is to really help to mitigate that and looking at that as how do we align the practice goals with the employee objectives so that we're driving success. From a legal compliance and an employment law perspective, the focus here is to mitigate those legal risks and ultimately ensure that every employee is receiving fair treatment. And we're going to dive into that in a little bit of, again, some tips and tricks of how to make sure you're doing that. But these laws impact various HR functions. So that can include everything from recruitment, hiring, compensation, and termination. So one example of this is the concept of at-will employment, or as we call it, the at-will conspiracy, because there's this concept of, Well, anybody, most states except for one, unless you're in Montana, all states are at will, meaning an employee can quit whenever they want. You can fire them whenever you want for no reason at all on both sides. And the reality is, because of legal compliance, because of employment laws, that really is a conspiracy. You want to make sure that your employee management, your documentation, everything is in line so that there is no room for an employee to come back and claim, well, I was wrongfully terminated or I was discriminated against. And the reality is that's probably not happening, but with lack of proof for these things, it makes it really hard to fight against. And so that's where we see those dollar amounts tick up. That's where we see a lot of energy from practices trying to resolve these issues that really could have been prevented. So exploring strategies for effective employee management, like performance reviews, feedback loops, conflict resolution, those things all are setting yourself up for success, so that employees, again, are engaged and happy. But if anything happens, you have that documentation set up and you can, prove I was not discriminating or I was not playing favorites. And maintaining accurate and comprehensive documentation for compliance is really important. So this includes essential documents like employee handbook, job descriptions, performance evaluations. And again, we'll dive into that a little bit for more in a second. But just as kind of a tip, most documentation should be retained for 3 to 4 years. That depends on what the documentation is. So 4 years is really kind of erring on the side of caution. And all of that documentation that you're doing, if you are notating things that are happening through the employee journey, should be as objective as possible. So not using, too many adjectives, really using those objective words of what happened so that there's no, again, room for somebody saying, well, they were treating me unfairly because I'm blank. And you can fill in the blank there. It happens all the time. So we want to make sure it's objective as possible. So that brings us into kind of transitioning to our 17 proven tips. So these are not the only things you have to pay attention to, but we tried to consolidate it into these are absolutely the must-haves when we look at, okay, where do I start? So we'll start on the HIPAA and OSHA side, and we'll kind of bounce back and forth between the HR and HIPAA so that we cover the ground of both perspectives.
So I'll step in here. So yeah, the main thing is, we always want to start off with a year with a current risk assessment or a gap assessment. And what that does is that's once again that shows HIPAA and OSHA that you took the time as an organization to look at how your practice is currently set up, and if there's any gaps or risk that was uncovered, you actually met with a consultant. You have 30 days to kind of address those gaps. And normally what would be next would be a corrective action plan or a CAP call. That's how my company and our software works. We start there. But you always want to make sure that that's kind of the first step. Um, Binders customized. Like I said, unfortunately, they will never proactively reach out and say, we added this, we changed this. For instance, social media policy, right? That was not a policy January of last year. Now it is. They've actually added 6 brand new policies in the last 2 years. So that just kind of shows you how this is evolving. Obviously, the way HIPAA works is if a patient data is compromised, however that's done, that's how a new policy gets created, right? Whether it's somebody's, a shredding company that dumps it in the trash, or now social media, there's a lot of real-time updates that happen, and that's why it's very important to do an annual HIPAA OSHA risk assessment, binders, customization, and then of course, just making sure your policies and procedures directly reflect how your office and clinic is set up. Training is also part of that. We want to make sure that we're meeting those annual requirements for training. And like I said, most importantly, having something in place for new hires, I think is really, really crucial, especially in healthcare with the unfortunately the turnover that we have. We want you guys to continue to treat patients, to continue to increase production, but we also want to make sure that there's not a huge gap if there's a new hire on the compliance piece.
Mhm. Yeah. And in that vein, very similar when it comes to your employee handbooks. These, laws change throughout the year, regulations change all the time. This should be updated whenever these laws change. So that could be once a year, that can be twice a year. Sometimes it's more than that, but again, that really depends on where you're located. But just making sure that you are aware and you're, subscribing, whether it's to a newsletter from HR for Health or some other resource, to make sure that you have that awareness. Because again, the agencies aren't reaching out to you when these laws change. They're not saying, hey, there's a new I-9 that's come out. That's something that is on you as a business owner to make sure that you're staying up on. So that's a really important part. The other part is making sure that you're getting your employee handbook from a reliable source. So this could be, a lot of different places that we see people get their handbooks from, but the most common, we found over 75% in a recent survey that we did of people received their employee handbook from a friend or a colleague and then tweaked it to their practice. So that's a really, really high percentage. And first of all, you don't necessarily know that your friend or colleague had the correct laws or the correct policies in there. And you don't know how their practice is running. So everybody needs their own unique customized handbook to the policies and procedures that you're following and also that you're required to offer in your state. So please, if you've gotten your employee handbook from somebody that's not a reliable resource like an HR company, a payroll company, your friend, that's an indication that that's a great place to start of making sure that that's updated for this year. And the other part of it is that the employee handbook needs to be utilized. So we see a lot that, okay, I have my handbook, it's in, a file drawer, and I might give it to my team on their first day when they start, but then they're not really following the policies. So what you have in writing should be accurate in terms of how you're running your practice. Really common example that we see is there's something in writing about vacation time and what vacation employees get, but there's something completely different actually happening in terms of how the employees are getting the vacation, what they're getting offered, when they get those hours. And so being able to streamline that, exactly what you have in writing should be what you're offering. And that really applies to any policy. If you're not planning on following it, it doesn't really make sense to have it in writing. So it really should be an accurate reflection of how you're running your practice. And again, it should be accessible to the employees throughout their employment with you so that they have visibility to what your policies and expectations are.
Okay, so moving on to more yeah, paperwork, I guess. We want to make sure we want to make sure that, when these trainings are being completed, right? Whether it's your officer training, security officer training, HIPAA, OSHA trainings, that these are being documented. Now, obviously, one of the nice things, I keep coming back to Rectangle Health Compliance, and what we offer is every training module in our software comes with a documented PDF with a certificate of completion. So we want to make sure that not only are they taking these courses, but we're documenting that progress has been made. Because once again, God forbid there was ever an audit or a breach, that would be one of the things that they would ask for is the documentation that this training was completed for this hire. So it's another kind of box we need to check, but also very, very important. And at the end of the day, we also don't want to send our entire team to the Hyatt and listen to some huge class and they kind of everybody goes yeah, 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 and they don't retain anything because that doesn't really protect the business owner or the doctor provider when they get into their in-clinic work days. So that's why it is nice to have proper training in place, and then of course documentation that was completed.
Yeah, and I think Ryan brings up a great point. Like a lot of this stuff, while it might seem like it's a box to check, it's really the implementation and the following of these regulations that are just as important. The documentation is what proves that you're doing that. So keeping detailed records of employee information, contracts, performance reviews, disciplinary actions to show that you're in compliance with the legal requirements is really important. So one example here that's kind of low-hanging fruit that we see is not being utilized the way that it could is using an employment application for potential new employees. That's something I would highly recommend implementing if you're not already, because an employment application really is a guide for how you're handling the information for that employee, and it does need to be state specific. So, for example, many states do not allow for applicants to be asked about past salary information. You can ask what the employee expects to make, but you can't ask what they used to make. And so if you have a compliant employment application, that will help you to follow those rules because it states, what you're asking for and the applicant is signing off on those things. There's other laws around when you're allowed to do background checks, and in some states you have to have a full offer out before you're allowed to do a background check. So it's these little nuances that really make a difference, and also be able to, or having that on file, whether you hire that person or not, is a great way for you to show that you are going through the process really intentionally, and that you have reasons for why you hired them or why you didn't. You weren't asking the things that you weren't supposed to. HR for Health has a great resource on interview questions to ask or not to ask. You want to have consistency on that side. So that's even looking at before somebody even comes into the practice. But keeping that kind of theme throughout is you always want to have that objective, consistent documentation for each employee, from the new hire perspective and offboarding. We'll talk about that in a little bit. But just thinking about, okay, am I even asking for somebody to give me an employment application and give me reference checks? And are they signing off on that? And what should I ask? And what should I not ask? And what am I documenting? We have a lot of guides around that to help you. But to get that buttoned up as early as possible is a really good idea. Again, another kind of thing for your list. If you're not using an employment application, with all the turnover that's happening and the people that we're trying to get into the office, that's a great place to start to help build your compliance. So once you're ready to onboard and have that employee management, you're kind of setting the stage for what's documented. All right, I'll kick it back to you.
So this goes back to you know the training for HIPAA and OSHA, right? You want to make sure that we're focusing on not only the requirements that we need for handling patient information, but you want to make sure there's some cyber training as well on and that all falls into the courses normally when we're doing our training. In clinic, right? Workstation use policies, things like that. But that is where a lot of breach and risk can be completely avoided if we know that our team is properly trained on what if something does happen, right? When we're talking about downloads, there's courses that can be taken on cybersecurity. There's courses that can be taken on phishing and malware and what that looks like, and look for grammatical errors, hover over the link and see where that URL leads. So that's where, once again, a proper curriculum, I guess the best way to put it, is in place, because it will cover cyber and workstation use policies, because 9 times out of 10 it's not something malicious that happens at night while we're all sleeping. Most of the time it's happening in clinic. We send a link, we click on something that looks like it's from a provider or someone that we work with, a colleague, and that can lead to a backdoor breach that we don't even know it happened. Most of the time, that's another kind of shocking thing when we talk about cyber liability insurance is, there's a very high percentage of practices that, usually 3 to 6 months, they don't even realize that they've been hacked until about 6 months in. And that's where that list I showed you, you'll notice that it's only over 500. So that's where, um, you know, that's kind of one of those checklists that we, when we consult practices is, if 500 or more patient records were compromised, you by law have to notify the U.S. Department of Health and Human Services, send out emails, send out notifications to your patients that this happened, and then you end up on that list. So um, as simple as it sounds, right? Just the right kind of training. Even in my working for my company, we go through cyber training and email phishing and malware and what that looks like. So I know that we all want to focus on production and revenue, but this could be a very big problem if it's not taken seriously for sure.
Yeah, and it's getting really sophisticated. It's funny that same conference I was mentioning that I was at last week. I had a meeting with one of the banks that is pretty prominent and prevalent in the industry. And I walked up and they were wrapping up a meeting with a doctor, and the doctor was showing on his phone an email that he thought had come from that bank. Like the signature in the email looked exactly like their signatures, and it was a complete phishing email. And they were like, nope, that's not us. If you can see like who it was sent, they changed one letter in it. And so it's getting really sophisticated. It's kind of scary, but it
Hmm.
definitely requires that training. Okay, so I cannot stress this enough. And this really ties back to having your policies in writing, but making sure that you're consistent with all employees is going to be a lifesaver for you in terms of not just avoiding favoritism claims in the office or resentment from existing team members or whatever, but if you part ways with an employee, that they are not able to say that it was wrongful termination, discrimination, all of those things. So, and this might be like, okay, well, how does it get to something that big? And so some examples of this are if your policy in your handbook, let's say you have a cell phone usage policy, most handbooks do, that say cell phones are not allowed in the open in front of patients in the practice for HIPAA reasons, whatever it might be, that's your policy. They must be left in the break room. But your favorite, most productive employee is allowed to use their cell phone because what's the harm? They're producing for me, they're engaged. Well, the harm is that you're establishing inconsistencies with your team. And this creates resentment and claims for favoritism and just a lot of issues. And really, you can insert whatever scenario you like. This goes for holding some employees accountable for certain things and others not. So maybe certain ones are being held accountable for being tardy and not making the morning huddle, but others that are your favorites are not being held accountable for that. Or allowing certain employees to take days off at the last second, but you're disciplining others for doing the same thing. So these can be really seemingly small things that, again, create not a great culture in the office, creates resentment, but also can lead to bigger issues. So all employees should be held to the same standards no matter what, no matter how much you like or don't like them. It should be objective, and all of those things should be in writing. And like I mentioned earlier, if you don't plan on holding somebody accountable for something, there's not really a point of having that in your policy. If you don't care if people are late, don't have it in your policy. I mean, I don't know that anybody doesn't care about that, but if you're not going to hold everyone accountable in the same way, it really doesn't make sense to have it in writing. But you do need to have things in writing to set that standard so that you're setting your expectations, and then everyone needs to be held accountable consistently. And that's also why it's so important to make sure that your handbooks are accessible throughout that person's employment with you so that you can always reference back. They can always reference back for what your expectations are. And again, everyone is treated fairly and consistently throughout that process.
And yes, make a big deal out of passwords, right? So that's the next slide. My company, right? We are a healthcare technology company. Uh, we have monthly password changes. As annoying as it is, it's just it's another step to being preemptive, right? Taking a preemptive strike on compliance and protection of the practice. So, whether that's something that you guys do an automated, use an automated software, or if you have a timer, right? I just try to make sure that you're setting some form of cadence in clinic to make sure that we're doing that kind of password change. Once again, it might sound like a task that doesn't need to happen, but it can be very, very, very important if it goes the wrong way. So taking that time to do these password updates, whether it's quarterly or, you know, you know, at least once a year, I would say twice a year probably, but we want to make sure that's another box that we're checking when it comes to taking that preemptive strike.
Hmm. Um, this could be a whole webinar in itself of creating benefit packages. We don't have time for all of that today. What I would say with this is creating offerings does not necessarily mean the highest hourly rate. It could mean that. I know that right now there's a lot of back and forth and kind of battles of, well, I can get $10 more down the street or whatever it might be. And everybody's trying to stay really competitive. You don't have to just look at your hourly rate with this. So there are other things that go into benefit packages for your team that are things like career development or mentoring, paying for CEs. We've also seen a lot of success of practices helping to pay off student loans for some of their employees. That creates a lot of loyalty. And also, of course, you want this in writing. And if they leave, there's wording in there about what that means of what they owe you and all of those things. But those payments can really make a difference. Like it doesn't just have to go into the hourly rate. The team members want to see that you're investing in them and their career. So looking at those CEs, loans, whatever you're able to do that makes economic sense for you, there's a lot of tactics around that. Of course, looking at how can you offer competitive vacation offerings? Like flexible work schedules are very, it's kind of the buzzword right now of they want to be able to make their own schedules and, gig work is a big thing. And of course, the practices still need to run how they need to run. So it's not just about what's best for the employees. They need to be contributing to the overall success of the practice so that you're able to accommodate what they would like to see. But looking at those offerings, again, for time off can really make a difference. Even something as small as offering a day off for their birthday. That's one extra day that makes them feel really special. It's their, I'm celebrating myself. Again, it's what, 8 hours that you're offering them that's kind of like a floating holiday. And again, ultimately, it needs to make sense for both the practice and the team. I think the biggest thing with this is it doesn't have to just come down to the highest hourly rate or the highest percent of production or whatever. And we're in California, so we see the craziest amounts that are being offered. But look at this of really investing in how do you get them to stay with the practice, and compensation, like straight hourly rate, is like fourth on the list of what people care about. It's really about, do they see this as a place long term that they can develop their career? So there's a lot of strategies that you can do to bring that in.
So this is also another important step, not really geared towards right in clinic HIPAA OSHA requirements, but this is something where you want to make sure if you have an IT, right, if you're using a third party, that they are continuing to update firewalls, antivirus software, right, protecting the actual hardware in clinic. It's just another, link in the chain of compliance. Most of the time, that's something that you can really kind of pencil out with if you have an IT company or a third party IT, that's something that they'll address with antivirus and operation systems. But the main thing is we don't want to, we don't want to back up to be a doctor putting a USB in his, and dumping his files and taking that USB with them, as the security backup. And yes, that has happened. If you go to that U.S. Department breach portal, there was a USB. The doctor's car was broken into, and I think about 12,000 patient records were compromised. So
Wow.
that's yep. So that's a true story. But yeah, we want to make sure that you know, along with HIPAA, OSHA compliance in clinic, along with email, right? Uh, awareness of malware, awareness of what that would look like. We also want to make sure that we have a proper, game plan from our IT company, that they're updating firewalls and antivirus software as well. But that's most of the clinics that is kind of day one, kind of common sense stuff. But I'm glad that we're talking about that one for sure.
Yeah. Another topic we could do a whole webinar on, but ensuring employees are classified correctly is so, so important. So this breaks into kind of two things: classifying employees as exempt or non-exempt, and then also classifying employees as, or team members as, independent contractors. So couple nuggets on this. We'll look at the independent contractors first. This varies per state, but for the most part, an independent contractor is somebody that has the freedom to make their own schedule, to decide when they would like to work, what types of patients that they would like to see. They're bringing their own patients, bringing their own supplies. They're truly independent from your business. So the safest way to look at this is, if you have an associate doc that is a specialist that's coming in to do a different type of treatment on your patients than what you usually do, they might even bring their own assistant or whatever it is. That's usually a safe indicator that somebody is okay to be classified as independent contractors. The biggest reason why we care about this is there are two government agencies that care about independent contractors. There's the labor side of things, of just employees getting their correct offerings, correct payments, but then there's also the IRS that wants to make sure the taxes are paid correctly. So there is a lot of risk with incorrectly classifying people as independent contractors. We saw a huge surge in this during COVID, which was, all of a sudden all the practices had to shut down. They were trying to figure out, how do we continue to work? They told their team, go file for unemployment. The state will take care of you if you have unemployment. Somebody who's an independent contractor is not eligible for unemployment because they're not paying into taxes for unemployment while they are working. And so that created a lot of issues. Thankfully, it was figured out, of people who are independent contractors got additional funds that, was allocated for them, but that took a little bit. And so while I hope that that never happens again, where the entire country has to shut down, there are larger implications for the well-being of that person. And so even if you have a traveling employee that goes between offices, maybe is a temp for you, that does not necessarily mean they're an independent contractor. It really comes down to, are they making their own schedule? Are they really operating independently? The other side is exempt or non-exempt employees. So exempt employees, a lot of the times we see in offices, they assume, well, if I pay an employee a salary, that means they're exempt. So if I pay them the same amount every single week, I get to make them exempt. If they're an hourly rate, that makes them non-exempt. The reality is that somebody being exempt means that they are in a healthcare setting, really, that they're a true manager, or they might qualify for professional exemption, which are like our associates or higher earners that have certain degrees to allow them to offer certain clinical services. But for the most part, it comes down to, are they a manager? Are they overseeing more than one employee in the office? Do they have business making decisions, hiring, firing? Are they truly a manager in the office? Or again, if they're a clinical person, not a hygienist, not an optician, but a true associate that's coming in, a lot of the times those people can be exempt. So what we see is pretty much every single person in your office is a non-exempt employee. So that means that they need to be getting overtime. They need to be getting lunches and breaks. So in proper employee classification has a ton of consequences if you're not doing this correctly. If you have any questions on your current team, how you're classifying them, what that means, please, please, please reach out to us so that we can help you. Because this is where a lot of claims come in, because people are not getting overtime, they're not getting lunches, they're not getting breaks, because you're assuming, I just pay them on a salary and I'm good to go. But it doesn't have to do necessarily with how you pay them. It has to do with what their actual job contributions to the practice is, day in and day out. So back to you, Ryan.
Back to me. So this is another big thing. I kind of almost foreshadowing here, but back up your data offsite, right? Multiple backups are important. If you're using your EMR, a lot of times that's where they will kind of have a automated cloud-based backup on their end. If you have a third-party portal, right, that's another big kind of gap. You can fix these kind of problems. But once again, we just want to make sure our backup is not a USB, a personal laptop, something we're taking with us, right? We don't want to be backing up to an old hard drive that's locked, right, in the practice. I've heard that happen before too. Like that's how people back up their information. So we want to make sure that we are using a cloud-based storage that is doing either an automated backup daily, weekly, right? There's a lot of different options, but either just confirm that your EMR is doing that on your behalf, and that's all stored in a HIPAA and compliant environment, cloud-based storage, or your third party. Sometimes your IT companies they'll offer that you know data backup. There's usually a small cost involved in that as well, but definitely crucial because what we want to avoid is, God forbid, something does happen, and if somebody did break into the practice at night and they stole the computers, one, um, you know, there's no information on there that's going to get hacked or stolen. But two, we're not starting from scratch when we do get back to business and start going again. You can automatically log in, right? Get your records back and your patient information that you need, and that can be the difference between like I said, shutting the doors down for 6 weeks or 6 days. So
Mhm.
big difference there.
Yeah. This is why classifying your employees correctly is so important because this, if they are non-exempt employees, which again, rule of thumb, pretty much everybody in your practice is a non-exempt employee. It's important that they are getting their meal breaks, rest breaks, overtime. Over half the states have some sort of meal or rest break that you should be following. As a general rule of thumb, anything that's between 5 and 20 minutes of some sort of break should be paid. So if they are taking a 10-minute break, do not require them to clock out. It's anything more than 20 minutes that you can allow them to clock out. So again, general rule of thumb, 30 minutes to an hour, that's a typical lunch. You can require them to clock out. If it's 5 minutes here, 5 minutes there, they should be staying clocked in. But this is absolutely varies per state. Again, it starts with classifying your employees correctly to make sure that they are getting the things that they are owed when it comes to meal and rest breaks and overtime. But if you have any questions on what your requirements are, please reach out to the HR for Health team. We will make sure to help guide you because this is where so many claims come into play because employees just aren't paid correctly.
So this is, one of the big things that we always, whenever I'm having a consultation with our clients, is, we want to make sure, I kind of touched on this earlier, but a lot of people think that this is wrapped into their malpractice or it's wrapped in or their IT company covers this, right? You want to make sure that you definitely have a separate cyber liability or cyber insurance policy that protects the practice, God forbid, a breach, right? An audit. But you also want to make sure that you're looking at your current coverage, right? And I've seen it happen way too many times where people have $1 million policy, but when you read the fine print, there are so many variables for this coverage to actually cover you. It's basically not like not having coverage, or it'll say $1 million, but when it comes to actual HIPAA audits and fines, it might be 100 grand, right? So you want to make sure that you're looking at, the real hard cost to the practice, right? Loss of profits, employee error, if that led to a breach, right? If we did have to shut down the practice, and I still want to keep my 12 employees, that's loss of profits, right? Will my cyber insurance policy cover that? Now, our software that we provide comes with an ironclad $250,000 in cyber liability insurance that is 100% day one approved and covers our client for any loss of profits, any hard costs that would be incurred from a breach. So that's really where you want to make sure when you're looking at your policy. what is the actual coverage for hard costs incurred to the practice? Because that's what directly affects the doctors and the owners. And that's where, you just want to make sure that it's very, very specific, and not something that's kind of layered in with other insurance for the practice. You want to make sure it's a separate policy, that's set aside for that.
So starting off on the right foot with your team, very, very important. So on average, there are 12 to 15 documents that you must provide to employees on their first day. Most practices have about 3 to 4 before we start working with them. So it's really important to make sure that, again, these are state specific. If you're in states like California or New York, we're pushing about 20 documents you have to offer. So this is on average 12 to 15 documents that, from an HR compliance perspective, every employee needs to get. That really sets you off on the right foot, to make sure that, and if you don't have all of those, you can use an excuse like HR for Health to, you onboard them, they get all of the documents, even if you've given them a few of them so far. That way it doesn't raise red flags, like if you haven't given them prior. Also, things that should be in there, job descriptions are huge. How are you going to hold them accountable for their position when we talk about doing performance evaluations and holding them accountable if there isn't a foundation of what their job expectation is? Also, an offer letter. This might be seemingly small and just looking at, oh, well, I'm communicating to them how much I'm going to pay them per hour and how much vacation they get. The offer letter is also stating what their schedule is, when they're supposed to be working. So if they're deviating from that, you have something to reference back to. So again, there are mandatory documents. There's also ones that are not necessarily written in the law that you need to give, but are really, really important to give so that you're able to not just hold the team accountable, but they know what you're expecting of them. That's usually the biggest gap, is that they're trying to guess, you're trying to guess. This makes it really, really clear. It sets that foundation for accountability and transparency. And just like those new hire documents, there are mandatory documents for the termination process. So whether that's somebody that's voluntarily terminating, meaning they quit, versus if it's involuntary, you're firing them, there's different documents that they need to be given, and that offboarding process might look different if they are quitting versus if you're terminating them. Within that process, kind of, Ryan mentioned the password thing. If there are shared passwords, shared accounts, like that needs to be part of your checklist of changing that when employees are offboarded. So all these little details need to be thought through to make sure that you're protected, you're doing these things efficiently, so that employees are no longer having access to things that they should not once they are offboarded.
So this is where, the beauty of Rectangle Health and kind of what we do is, we are healthcare specific, and PCI compliance is 100%, how our software is built. Whether that's our compliance users, we do PCI compliance and quarterly scans. I'm sure our listeners and people tuning in, it's one of their favorite things, right? Those 90 questions on how you're taking cards and what you're doing with that data. We want to maintain that you have your PCI certification, just like your annual risk assessment. That is one of the biggest benefits of being a Rectangle Health client, is we actually kind of walk you through that and do that for you. It's a template almost. But just so to kind of give more high level knowledge, PCI compliance is payment card industry, and it's usually data security standards, right? So it's part of being HIPAA compliant is being PCI compliance, which means part of being HIPAA compliant is protecting your patient's credit card data. So that's why you want to make sure, whether you're taking a transaction, storing a card on file, it's all happening in an encrypted PCI compliant way. And basically what that is if you took a payment through Rectangle Health, it takes those 16 digits and it scrambles it up into a couple thousand characters, and that data is never stored on your computer. It's all stored in a cloud-based environment, and you're only seeing the last four in clinic. So PCI compliance is very important, but once again, it's just another box on the HIPAA compliance piece as well. But you want to make sure that you have that certificate and validation yearly as well.
Biggest thing with this, please ask for help when employee situations arise. That could be good or bad. We just want to make sure that you are being proactive with how you're handling these situations. Everything from, again, onboarding, working interviews, questions to ask during the interview process, all the way to termination, how to handle protected leave of absence like pregnancy leave or disability, workers' comp. Those things you're not necessarily always going to be prepared for. And so being able to reach out to resources like HR for Health or a lawyer that's trusted, knows the industry, is healthcare specific, those things are really, really important to help with the complex situations and make sure that your risk is really mitigated and as low as possible as you're handling these situations. Because you can't foresee everything that's going to happen with your team. So it's really important that you're seeking out a professional to help you when you're going through those situations.
And then this is another, we talked about this in pretty much the first slide is one of the other requirements that gets missed a lot is the emergency plan. And once again, that's really where you want to make sure that we have a documented who, what, when, where. If there is a breach, if there's a natural disaster, it's called the emergency plan. And you can download different kind of templates to make sure you execute that, but it's normally something you want posted in a common room, whether that's the lunchroom, right? If you have an employee specific kind of area, but you always want to make sure that's normally kind of, you know, postered up next to your OSHA labor laws. That's another great kind of place to put it. Want to make sure it's visible, but that's one of those things. God forbid there was an OSHA audit, right? And they were on site, they would look for that emergency plan, and when it was last updated. So that's kind of the. I know none of the stuff I talked about was fun, but it's all necessary. And I promise our software makes it easy. And once again, kind of like what you said, Jill, is just simplifying that workflow and making it efficient for everybody.
Yeah. Yeah, which kind of brings us to, as we wrap this up, our mutual goals are, again, of course, utilizing technology to get that automation and get that protection in place so that you can be focusing on the revenue and the patients that you're offering great care to. These things are always changing. And so being able to utilize resources like HR for Health, like Rectangle Health, so that you can stay on top of these things is so important because we know that there's so many other things that you want to be doing. Ryan and I are the weirdos who care about HIPAA, OSHA, and HR. We enjoy it. We think the compliance part is fun. So let us kind of help to utilize that. And you can get back to doing what you love to do.
Absolutely.
So as we wrap up, I know that we went to time. If there are any questions that came in through the chat or through the Q&A, we will absolutely get back to you. Our team will follow up with those questions or with answers to those questions. We will make sure that that link is sent for that resource that Ryan was mentioning so that you can have that visibility into the breach side of things. We will be actually doing a series with Rectangle Health. So HR for Health and Rectangle will be doing a couple more webinars together. So this is the first of a few. We thank you for joining us. Thank you, Ryan, for your great insight on this. And we look forward to seeing you guys on the next webinar soon.
Perfect.